This video is on 5 things you need to know about diverticular disease. So the amount of diverticular disease actually varies across different populations around the world, and it increases with age. In Western countries, where low-fiber diets are more common, the prevalence is higher. Rough estimates, they suggest that by age 60, about 50% of people in developed countries may have diverticula, or these pouches that form. And this increases to about 70 to 80% by age 80. In this video, we are talking about a list of 5 very important and perhaps less known things about diverticulitis and diverticular disease that I think you need to know. And this is very important, so stick around till the end of the video. If you're new here, I'm a family medicine doctor, and on this channel we talk about medical topics and lifestyle. So if that kind of stuff interests you, stick around, subscribe, and keep on watching the video. So we won't get into the finer details of what diverticulitis and diverticular disease is. Check out our other videos. But in this video, we're just going to highlight 5 nice important facts to note, and let's get into it. So the first is what I would call a myth, let's say. So nuts and seeds cause diverticulitis. So contrary to popular belief, there's limited evidence supporting the idea that consuming nuts and seeds contribute to diverticulitis. In fact, recent research suggests that they may not be as harmful as once thought. So this is something interesting. We made another video on this, so please check it out when it comes to the diet. So eating nuts and seeds when you're in a calm phase and you have diverticular disease will not provoke diverticulitis from happening. When you have diverticulitis, or when you have an inflammation in the bowel, like with inflammatory bowel disease, there is possibility that eating things that are a bit more difficult to digest, nuts and seeds being one of them, can maybe cause a little bit of trouble and worsen the symptoms or not allow you to heal as quick as possible. So there is a time and place when to eat these things. So the second thing here is that it's very important to note about pain and diverticular disease. So diverticular disease is more common in the left side of the colon. So while they can form in any part of the colon, the large intestine, they are most frequently found in the sigmoid colon, which is the lower left part of the colon. So a person with pain is going to have pain in that left lower quadrant generally when they are having a flare-up of their diverticular disease or when they are having diverticulitis. The third thing here to highlight is also a little bit of a myth, and that is that stress directly causes diverticular disease. Well, stress is not a direct cause. It might exacerbate the symptoms a little bit, or it might contribute to things because stress as a whole plays a role on your organism. You may have heard of the gut-brain axis and those kinds of things, the gut microbiome and dysbiosis. We made another video on that as well you can check out. But as things stand, current research doesn't establish a clear link between stress and the development of diverticular disease. So you don't get stressed out and then form these pouches. That's not the case. There are much, much worse and more kind of pronounced risk factors and more evidence-based risk factors that can cause diverticular disease to occur, meaning low-fiber diet and things like that. Please, we made a few videos on that topic as well with regards to the causes of diverticular disease. And then the other thing to mention here is that genetics do play a role. So there's evidence to suggest that there is a genetic predisposition to diverticular disease. So it might not just be what you're eating, what you're drinking, what you're doing, whether you're exercising, some of these other risk factors. There is a genetic propensity. So if you have a close relative with the condition, you absolutely might be at a higher risk. This doesn't just go with diverticular disease, this goes with other conditions as well. But for the purposes of this discussion, genetics, absolutely, they do play a role. But we did mention at the start of the video that majority of people, they actually will get some sort of pouches, some sort of diverticular disease as they get into their elderly ages. But not everybody's going to have these pronounced symptoms and things like that. There is a genetic component into the development of diverticular disease. And, if that is the case in your family, it's worth focusing even more so on the preventable risk factors, the things that you can control. Genetics isn't something you can control, so don't even stress about it. Focus on the things you can control. And the fifth thing is also a little bit of a myth, I suppose. Not really a myth, but something to consider. Antibiotics are always necessary to treat diverticulitis. So if you are having a full-blown flare of diverticulitis, and if you have temperature and a fever essentially, and if you're having a lot of symptoms, then absolutely antibiotics are going to be needed, and we need to act accordingly and treat that. But mild cases, they can maybe be managed with dietary changes, pain relief, conservative management as a whole. We made a really good video on this topic, so please check it out. A lot of the times, doctors really jump to just giving you, painkillers and antibiotics and things like that. But you can maybe manage very mild cases with other ways. And these are, again, the ways that you are controlling that through your lifestyle, through the diets that you're eating. You can maybe get prescribed a certain diet, for example, and things like that. We covered that, but that's very important to note. And on top of that, just to finish, the most important thing on top of all this is to try and prevent a diverticulitis attack from even happening if you have diverticular disease. So focus on those things that you can control, the risk factors, the diet, the exercise, the psychological component. Focus on all those things to try and prevent yourself from ever getting diverticular disease, and B, if you have diverticular disease, limit the amount of time, hopefully, that you are getting a flare-up or diverticulitis. If you like this video, please comment your thoughts in the section below, like and subscribe for more. We'll see you in the next video.